Hi there, my name is Meredith Wallace and I'm a skincare specialist here at RevitalyzeMD. Today we're actually going to be showing you a live video of our Eyelase treatment with the Photona laser. And starting from the beginning all the way to the end, there will be opportunity to be able to share with you the whole process. And please like and subscribe to our page in order for us to provide you with more information about what all that we do here. All right, here we go. So this is our Eyelase treatment, and to prepare for the Eyelase treatment, we're gonna make sure to cleanse the surrounding area really good and apply some numbing cream on the extraocular area around the eye. We wanna make sure that all of that is sufficiently rubbed into the skin and allow a few minutes for that to thoroughly absorb so she has a lot less sensitivity. And then next we're going to go ahead and apply a few numbing drops into each eye to prepare to put in the eye shields for the intraocular portion of the Eyelase. This is a picture of our eye shields themselves that go right over the cornea of the eye. So we put some lubricating gel inside the shield so it doesn't scratch the eye itself. Everybody's eye shape is a little bit different and the size of the eye is a little bit different. So sometimes these are a little bit complicated to insert, but ours are middle of the road size wise, and we've not had any problems getting them in anybody's eyes so far. It's a little odd feeling, so that's why we put a lot of numbing cream around the eye, numbing drops inside the eye, and then also a lot of lubricating gel on the shield itself, so we make sure that it just slides in without any discomfort on the patient end. So beginning to do the intraocular part, we have to laser the mucus portion just underneath the eyeball. So we use gauze or sometimes a tongue depressor to fold down the tissue underneath the eyeball in order to reach that. And there's a certain amount of pulses per eye that we do require in order to get sufficient treatment for the intraocular portion. So everybody's a little bit different as far as how many they need, depending on the severity of their eye bags and the severity of the thinness of the tissue underneath the eye. We basically just base that upon each patient individually, like we do with any other laser. So we're still on the left eye there, just lasering back and forth. Pulses range anywhere from 2 pulses per portion all the way up to 5 until we move on to the next spot size. Almost done with this eye. I'm getting ready to move on to the other one. Sometimes we have to add a little more of the lubricating drops in, just a standard lubricating drop if it tends to be a little more dry, or if they're feeling anything. We can also always add more of the numbing drops in if they have any sensitivity at all. Usually you will feel a little bit of pressure, of course, with anything, but most people don't really feel much of anything until it's over. And then even then, you'll still have some numbness for about an hour or so. We're going ahead and starting on the right eye, lasering that whole mucus area just directly underneath the eyeball. You don't want to laser on top of the eye, obviously. So number one, that's why we have the eye shield in, to make sure that we're protecting the eye. We don't want any scratches or abrasions. So just making sure that we really get the tissue underneath really good. And you can actually see that tissue, the inflammation will continue to expand as we go throughout the process. And that's what you want. You want to create an inflammation response in order for that tissue to be repaired stronger, thicker, and of course you get improved results as time goes on with this procedure as well. You're not going to see immediate results. Have a little bit of swelling, and then after a few days typically you'll start to see some changes around the entire eye, because obviously we're going to do the extraocular as well to help smooth out fine lines and wrinkles, and to help also build that collagen underneath the eyes to help thicken the tissue to cover up dark circles. Gonna go ahead and remove the eye shield to prepare for the extraocular portion. Let's go ahead and get those out of there so we can flush the eye clean. After we add the lubricating drops, and of course we've already got numbing drops in there, we have lubricating drops, and then we also have the new lubricating gel, which can tend to make the eyes very blurry. So generally we just get a flush that we would normally use for an IV and just flush as much saline as we need to each eye until they feel like they're seeing a lot better. Most of that is not immediate. It kind of clears out with time. Lots of blinking, more flushing, continue that process until they're comfortable with the way that they're able to see, and we can continue on with the outside of the eye, that extraocular portion. The metal shield that you see there is a Jaeger, and that mainly is to use to protect the eyelashes. You don't want to hit the eyelash with the laser. Of course, it can singe the lashes just a little bit and or dry them out just enough to where they may not grow as strongly as they were. So we want to try to protect the eyelashes as much as possible. Laser the whole eyelid as far down towards the lashes and even over the eyebrows just a touch. Trying not to laser over them too much, but obviously you want to tighten. Make sure that you're getting the whole tissue around the eye so everything is tightened and brightened and lightened in order to get the best possible result all the way around the eye. So once the eyelid is done, we'll go underneath the eye, kind of do the same thing. Make sure that the tissue is being stretched tight. Stretch out any wrinkles and just continue to go back and forth over all of that tissue. And same thing on this other eye. We're going to go ahead and do the eyelid. Numerous passes. Generally, we're going in a crosshatch. So vertical and then horizontal with every pass that we do. Generally, we try to kind of make a mask around the entire area of the eye. So we'll do out to make sure to hit crow's feet and any of the area to the lateral of the eye as well. And then this medial portion that's closer to the nose. Try to get that area, make sure that we're tightening and smoothing out any lines that are on that area as well. So basically you're kind of just making a huge mask all the way around the eyes, anywhere where that skin tends to get thinner as we get older, and obviously we get more and more lines around our eyes as we age. The more movement we have, our smiling lines, frown lines, directly above the nose there where you see me lasering in between the eyebrows. That's important to get to. The smoother that is, the brighter and tighter that whole area will appear. And there we go. All right, so this is a quick before and after that I wanted to show you all about the Eyelase. Again, this is an awesome treatment for bags under the eyes, wrinkles around the eyes, crow's feet, thin skin, dark circles. So the Eyelase is one of our favorite treatments that we do with the Photona laser. And again, thank you all for watching. And if you have any questions, don't forget to like and subscribe to our page. Ask any questions that you like. And again, this is Meredith with RevitalyzeMD. We're here to revitalize your look, your health, and your sex life.